Hi, I'm Christiana Ortiz. Savannah, Annie, Tori, and I are going to talk about harm reduction versus abstinence recovery as methods for substance abuse recovery. So, harm reduction is unlike what a lot of people who are against it say, it's not about condoning or encouraging drug use. It's about being realistic. People are not always ready to stop using completely. And we can take steps in the meantime to reduce the risks to them. Um, Harm reduction is rooted in compassion, dignity, and pragmatism, helping people stay safer today while supporting long-term recovery when they're able and ready to have that recovery. It really helps meet people where they're at instead of forcing them to do things a certain way. So some of the principles of um, harm reduction are that it's non-judgmental, it's very person-centered. It's really a way to honor the person who is addicted rather than force them to comply. Um, by staying non-judgmental, harm reduction helps it keeps the door open between those providing treatment and the people suffering from addiction. Uh, it also it empowers people. So people are able to make safer choices when they have accurate information, education, resources, care, instead of alienating people who are suffering from addiction. We're meeting them where they're at and we're giving them the resources that they need to survive long enough to get to the point where they're ready to recover. And we're also building inroads with them. We're building trust, which can be very healing for a lot of people. Also, some of the things that are involved in harm reduction are providing sterile syringes, which prevents HIV and hepatitis, which then, prevents them from also spreading into the greater population. Um, Also, like naloxone saves lives in overdose situations. Um, so people who would die of overdose and never have the opportunity to make it to the point where they can face the work of recovery completely, they have a chance that they wouldn't normally have. And it also includes safe spaces where people can consume drugs and not be taken advantage of and not be exposed to uh, issues that would cause them healthcare issues on top of being struggling with addiction, then struggling with other healthcare issues. Um, Quite frequently, harm reduction is actually the first step that leads people down the road of recovery because it's not in their face, it's not pushing them to change, it's just being there, supporting them and treating them like people. So harm reduction works because it saves lives, first of all. The people who die from overdose, the number of infections. This drops significantly when a harm reduction plan is implemented. Um, it benefits everyone because the people who are suffering from addiction rarely have health insurance, and there's a lot of ER visits. So the community saves money by not having to pay for so many ER visits. The people who are addicted are saved, but it's also the communities, which so that lowers healthcare costs and it also creates safer communities. People are also far more likely to eventually seek help into a complete recovery program when they feel respected, cared for, seen, rather than shamed and despised and forced. Uh, Ultimately, harm reduction is about human rights. Everyone, even people who are addicted, everyone deserves safety, health, and respect.
Okay, so now to get into the abstinence-based model. So, through this model's perspective, recovery is defined as complete and ongoing abstinence from all substances. This includes like, say you were like addicted to alcohol for years and years and years. Um, and then you switch to marijuana, but you no longer use alcohol. As long as you are like using substances compulsively or really at all after you have like been a serious addict, you really aren't seen as in recovery until there's that like complete abstinence from any sort of addictive substances. So there's no like substitution and things like that. It's like viewed as complete abstinence. And then the model assumes moderation as unsustainable. So really that same thought process of like once you have gone down that road as an addict, there's really no way to use substances in any sense in moderation. And then, yeah, views total avoidance as the safest option. And this model definitely views addiction as like an a brain disease and it really views that like addictive substances and repetitive use of addictive substances alters your brain and like hijacks your reward system. And after this process, there really is no way to use substances in moderation due to like the nature of the way that your brain now operates. And so yeah, this like addiction is viewed as like in a brain disease or an illness almost in a sense informs a lot of the principles that we're going to get into right now. So yeah, kind of similarly, core principles include complete sobriety, viewed as like the only safe and the only sustainable option. Again, like addiction alters your brain, hijacks your reward system, makes you incapable of using substances in moderation. Um, I mean, we've learned a lot about it, but just like that reward system is no longer functioning in its like normal capacity after substances have been used compulsively for extended periods of time. So this model definitely views recovering addicts incapable of using um, any sort of substance in any sort of moderation. It's just complete and total abstinence. Um, and yeah, this model definitely sees it important to embrace abstinence as a lifestyle. Um, like going to the next point, AA meetings are, or like NA, any sort of the 12-step program. Um, this is definitely where this like abstinence model has based out of has like sparked from and they're very like intertwined every 12-step model like preaches abstinence as like the only form of like having like a full life and recovering from addiction. Um, and probably one of the best parts of these 12-step programs is the community that it offers and just like being able to hear about other people's testimonies and different like stories of recovery and things like that. Um and yeah, just attending a 12-step meeting, like abstinence is very clearly kind of the central theme or understanding um towards like a healthy and happy lifestyle. Um again, only specifically for people that have struggled with an addiction in the past and are seen as like incapable of using any sort of substances in any sort of moderation, and even sometimes like goes as far as like seeing like gambling or even like compulsive sex as like something to abstain from as well. So it really like this like I'm sharing, it really views abstinence as like a lifestyle that like kind of bleeds into your whole life. So if you're like a recovering, like I said earlier, uh, addict in the terms of like using alcohol, um, like it's really seen as like complete abstinence to be from any sort of substances, any sort of like compulsive behavior, things like that. And then as far as why this model works and is so helpful to so many people, and it's kind of like the gold standard for recovery in a lot of ways, is because the model is so clear and the boundaries are so clear. And I think with addiction, it can be easy, like the whole recovery process can be like very ambiguous, and people with that struggle with substance use disorders, like definitely for years and years like talk themselves out of like I'll stop using tomorrow or I can cut back or I'll stop using really actually like after the weekend is done, and like there's just so much ambiguity that like leads and reinforces addiction that like this model really just helps there be such clear boundaries, and this really provides like a very structured lifestyle that leads to very long-term change again within that community support, the 12-step groups, things like that. People really tend to take on like abstinence as like a lifestyle or an identity in some sorts. And this really reduces triggers and supports against any sort of relapse. Um, because it's pretty much it's very much common knowledge that like once you have an addiction, even just a little bit, like even just one drink, um, as a recovering alcoholic can send you into like a total binge. That's obviously not the case for everyone, but that has definitely been shown to be true for people that have had serious struggles with substances and stuff like that. And this model definitely offers people a very hopeful identity shift. A lot of people get to some very low points. Addictions are no joke, and the way that it alters your brain and really takes a hold of you is very serious, and it's not an issue of like moral bad decisions. Like addictions are so much bigger and greater than anyone can really ever put words to, and the way that it hijacks your brain, it really just is a very, very, yeah, difficult disease to endure. And it's not just like a moral failure. And I think like it can be a very like hopeless process. And this like abstinence model really provides people with like this hope that they can be free from substances, and that these 12-step meetings really provide a network for people to get to know other people that used to struggle with substance use in the past and now are free from um, compulsive using and things like that. So, yeah, I think this model is the gold standard for a reason. And in a lot of ways, it offers some really helpful path, a very helpful path towards health, healing, and recovery.
Hi, I am Tori Michard, and I'm going to be presenting on the distinctions between the harm reduction model versus the abstinence-based recovery model. So, first I want to start in the core philosophy. So, in terms of the abstinence-based model of recovery, to be in recovery, you have to completely abstain from all substances, including alcohol. I do see some people using cigarettes typically in 12-step recovery programs. Those tend to get a little bit more of the green light, but besides that, complete and total cessation from any substance use. And then they do not view substance use as a part of recovery, and they believe that people who have had a history of substance use cannot safely use any other substances. So say you had a heroin problem, you cannot use alcohol. Say you had a meth problem, you cannot smoke marijuana. Whereas in the harm reduction, recovery is looked at as reducing the negative consequences of substance use, even if substance use continues. So say they were a very heavy drinker and now they're a more moderate light drinker, that is viewed as recovery. Substance use is seen more so on a spectrum to more severe to less severe, and progress is monitored on that continuum. And any progress where it is less harmful, less severe use is viewed as success. And then this is just really focused on meeting people where they're at. It's much more individually focused, whereas abstinence-based is a more traditional route of recovery that has seen a lot of success. In terms of goals, the abstinence-based model of recovery their goal is complete and total sobriety from any mind-altering substances and or addictive behaviors. So say they have a problem with gambling or shopping, so any of those addictive behaviors they want complete and total abstinence from. This often involves lifelong maintenance, and typically this is seen through 12-step programs. Harm reduction, on the other case, is the main goal is to minimize the harm. So preventing overdose, decreasing social harm, decreasing financial harm, whatever that looks like for the individual. Once again, goals catered very much to the individuals. This could include a decrease in frequency. This could include safer use. This could include abstaining from specific substances, like say heroin was your main problem substance, so abstaining from that. Views of relapse, where these guys differ. So the abstinence-based recovery model typically views relapse as a failure or a setback, and requiring one to restart their recovery journey, right? So we see that a lot in the 12-step models, where if they relapse, they are back on day 0. Even if they had 20 years of sobriety, they are back on day 0. And this is more likely to carry a bit of stigma, a bit of shame. Although some models frame it as a part of the process, having to start back on that day 0, I think can contribute to a lot of the shame, a lot of the stigma, a lot of the fear associated to slipping up and making a mistake. Whereas the harm reduction model typically looks at relapse as an expected part of change for many people. So it's expected. It's a part of the recovery process for many individuals, and it is seen more so as a way to gather information and data to better understand their substance use, to better understand their triggers, to better understand what they are okay with and what they are not okay with, and relapses are not seen as a failure. And then in terms of strategy, so once again, we're back with the abstinence-based 12-step models, AA, NA. These people typically will do residential treatments and then go on over to a sober living facility where no substances are allowed. And then relapse prevention is through strict and total avoidance of any substances, whereas the harm reduction model focuses more so on maybe safe needle exchanges, safe injection sites, naloxone distribution, which is a preventative of overdoses. So it's something that you can pass out to help people prevent overdoses. And they are okay with things like medication assisted treatment, otherwise known as MAT. So like things like Suboxone, methadone, those things are okay within this model. Whereas abstinence based, you might see a bit more pushback on the use of those, of those medications. And then harm reduction also focuses more on education about safer use and reduction strategies. So it's a little bit more education focused on what is safer for the user and less focused on just complete and total sobriety and abstinence. So I think the main takeaway is that harm reduction is focused on reduction of harm as well as focusing more on the individual, and the abstinence-based model is much more cut and dry, absolute sobriety, and is a more traditional model, which harm reduction is a kind of newer model.
Okay, so I'm going to talk a little bit about some of the similarities between an abstinence model and a harm reduction model. So as we've previously covered, just a little rundown, an abstinence-based model and harm reduction model most differ within kind of their targeted outcome. They do share a lot of similarities, but it is important to know that like the biggest difference between the two is actually like the way they try to achieve their goals. So first, obviously an abstinence-based model requires that participants do not use any substances and abstain from all substances. Which ultimately makes their goal to achieve abstinence and overall promote the individual and support them in their recovery. While harm reduction model still is promoting recovery, however, it's more based on like interventions that seek to reduce the harm caused by substance use, but it doesn't actually require abstinence. So a little bit of a different kind of path of how they support an individual, but they still hold a lot of similar values, which is really interesting. So I've kind of grouped together the similarities in 4 different sections, with the last one being kind of more of a catch-all. But starting with individual well-being, both models within harm reduction and with abstinence-based, a big quality that they both share is the desire for an individual's well-being to be improved. So regardless of their treatment modality, that is something that is seen with both types of modalities, and is definitely a goal that both of them share. So for example, like harm reduction aims to promote safety, and maybe like decreasing risky behavior and improving overall life function for the individual. So an example might be like if they're seeking treatment for their addiction, maybe focusing on like how can we increase the likelihood that this person will stay safe while still using. And then also like maybe supporting them in their social network, like how can we maintain your relationships, that sort of thing. So how can we overall improve the quality of life with substance use still in the picture, where an abstinence-based model still has the goal of improving the quality of life, and also just like making sure that their health and like mental health, physical health, all of that is sustained, but by removing substances and using abstinence as the kind of like catalyst for change. So even though different modalities, still like the same goal underlying is there. The next one is social support. So both models recognize the importance of the social support in recovery. So that's something that's also been stressed in class as well. Something we've learned is so important for a recovering individual is their social support and social network. So it's interesting to see that both of these models still hold true to that. So yeah, like I was saying, even though they differ in different ways, it's really, obvious that both of them incorporate social support within their modality. So for either model, a recovering individual could be involved in some community group, like for example, Alcoholics Anonymous or other peer support groups, things like that. And then also may use like psychotherapy, or any other kind of type of peer support, in addition to the substance use treatment itself. Okay, and then client empowerment. This is another similarity that both of the models share. I found this really interesting because it seems a little bit self-explanatory, but it's really cool to see how both of these models interact with client empowerment. But first, both models value the client's autonomy within treatment. So this is really important in therapy overall, but especially in treatment. So making sure that it's the client's goals that are being met and client's agenda that's being pushed. So making sure that the patient or the client's needs are being put first above maybe what other needs might be. Another example of this are like the stages of change that each individual is in is honored in both an abstinence and harm reduction model, which is very important to both of those treatments. And then, like I mentioned, both of them are client-centered by honoring desired goals set by either the individual or also just in both of them, making sure that um, whatever the client wants to do is what is being done. So maybe for like abstinence, for example, like a certain time frame to become abstinent or certain goals they might have outside of being abstinent. Like I'd like to be abstinent and then create these goals moving forward. This is what I'd like to see changed in my life. But then that also could be seen in the harm reduction model where, okay, I'd like to improve XYZ qualities of my life. And then that would be what would be worked on. So it's cool how both of them have that similarity, but it shows up in different ways in the model. And then core ethical principles shared in each model. So again, we see they kind of share the same ethical principles in both the harm reduction and abstinence model. So just maintaining um, the highest level of care for each individual in both is really important. Okay, and then last but not least, like I said, this is kind of a catch-all for everything else, every other similarity that I could kind of find within the two models. So both models view addiction as complex. So both models understand addiction is something that is, more complex than just one kind of like a one level thing. So I did find that both models often collaborate with other professionals and also offer like possible dual diagnoses. So just again, making sure that addiction is looked at as a deeper issue than just kind of like a one level type of thing. And then also another factor I found interesting in both similarities is the value on therapeutic relationship and fostering a respectful alliance. So again, within both treatments, abstinence-based or harm reduction-based, the factor of having a therapeutic alliance and building upon the relationship was a great catalyst of change and also something that was really stressed within both of those models. Okay. And then here's a fun visual that I also liked about harm reduction versus abstinence-based models for substance use. So as you can see, we have a nice Venn diagram. So harm reduction and abstinence-based models, again, like we talked about, abstinence and harm reduction differ in like their target goal. So abstinence still is a zero tolerance policy, while harm reduction is minimizing harm without requiring abstinence. However, so they seem like very different on the outside, but some of the shared ground that they have is recognizing substance use as a disorder, substance use disorder as a health issue. So that's something we kind of touched on as well as incorporating other professionals into like a full wraparound type of care. They both aim to improve quality of life and health outcomes. So it's also something we touched on, whether it's through reduction of harm, increasing safety, increasing well-being, or overall just removing the substances completely. And then also, like we said, may involve counseling and peer support. So again, both of those social pieces are very important. And then last, can coexist in some treatment plans. So I found this really interesting. I actually didn't know this before, that you could have both a harm reduction and abstinence-based model within the same treatment plan.